Dr. William, let's talk about something you have mentioned many, many times because, a missing tooth, you have mentioned that it eventually will lead to gum disease, maybe even putting a crown into a bridge, actually, instead of an implant might easier lead to gum disease than an implant, simply because of the difficulties of cleaning. Anyway, let's talk gum disease. Almost every dentist I know says gum disease over a few years will eventually make you losing your teeth. And while I think that that's a bad thing, because number one, it's expensive to replace them, and who wants that? You know what I mean? Even if you have the money, you'd rather go and buy a boat with it or go on vacation with it rather than putting it in your mouth. And on top of it, many of us not always have it. It's expensive, and who wants to go and do this huge surgery? So while this is bad, at the very least, dentists like you make phenomenal implants, crowns, bridges, everything. Basically, you can restore our teeth pretty much to the original state if you have to and if we are willing to pay. So here's, however, what I think a gum disease is much more dangerous at, and that is while you have it, you have a disease, an infection going on at the gateway of your blood vessels, which the mouth is. When you have when you almost pass out, they put something under your tongue and you go, ooh, and you're right back to life again, right?
Right.
Well, which means it goes right into the blood. So you have an infection here, and you have that yellow, ugly, reddish pus dripping into your blood, ruining your kidney, ruining your liver. I have heard that there are babies being stillborn in California. Not too many, but they have probably not done too many autopsies. And nevertheless, it's definitely proven that the immune system goes down. The baby gets born premature and underweight with gum disease. So all that stuff happened. Wouldn't that be even more devastating to the lifestyle of a person than the missing teeth, which at least with money can be replaced? How the heck you replace a liver or kidney or the bloodstream, the heart disease, the brain stroke, because that infection goes right into the bloodstream and goes all over the place.
Missing tooth is bad in itself, but the overall systemic implications from periodontal disease is even worse.
Right.
The mouth is a gateway to your overall health. I see patients in my practice that suffer from severe chronic periodontitis, means it's been there for months to years, and they just ignored the symptoms, shifting teeth, a change of taste or odor in the mouth, halitosis, bleeding, swollen gums.
Halitosis being bad breath, right?
Bad breath. Yeah, very, very bad breath. They suck on a mint and it still doesn't go away.
Right.
They wake up with blood on their pillow. They brush their teeth or they floss and they find blood. You should not have any bleeding when you brush and floss, period. Any more than when you brush your hair do you expect to see blood on the comb or the brush. You don't. So if you find that you're brushing and flossing or you're waking up with blood on the pillow, that's a warning sign that the body gives us. As we said earlier, the body is a wonderful made mechanism. It'll give us warning signs. Bleeding is one of the number one warning signs of a gum infection. As I tell my patients, the only time we notice bleeding in the human body is a lady on her menses. Outside of that, it's a sign of a problem going on.
Okay.
If you're coughing up blood.
Okay, so we got that. Now, go tell me how far off I am with the statements I made in terms of that this ongoing disease in the mouth, which some doctors tell me is as big as the hand, which is fully infected in the mouth. As big as the hand. When most people have just a small little, half an inch of an infection on the hand or on the toe, we run to the doctor if it doesn't go away for a week or two.
That's correct.
As we should. I'm not saying we shouldn't. But here you have a huge infection in the mouth and we don't go to the doctor. So is it really true that kidney, liver, immune system is all affected? And I mean, if the immune system is infected, wouldn't be the next swine flu season, bird flu season, never mind swine flu and bird flu, just the normal flu season, which is for sure the harm. Wouldn't that affect the person easier, get easier fevers and everything, because all the defense system has to work on on getting that infection contained, but can't.
That is correct. As you said earlier, periodontal disease in the mouth is like a 9 square inch wound. So that's huge.
Wow.
And it just allows for ingress of bacteria and pus to get into your system. And you got to realize everything goes to the heart. Okay? So there's a link between periodontal disease and cardiovascular disease or heart attacks. That bacteria that causes destruction of the bone and the gums in turn will cause destruction of the heart tissue over a period of time. There's a link. There's a study that was done between the American Academy of Periodontology and the American Heart Association that found that link between chronic periodontal disease and heart disease. That's indisputable. There's research that's ongoing and has been done in the past between periodontal disease and diabetes. Those people who have difficulty in maintaining or controlling their blood sugar. When you have high blood sugar, it makes you prone to infections, not only in the mouth, but other parts of the body, but especially in the mouth, because that's such a high incidence of bacteria of all different types. And when your blood sugar goes up, now you have an oral infection, and then that oral infection in turn makes the blood sugar go up. So they work hand in hand with one another. There's a link between
It's a twindling spiral.
Yeah, double-edged sword. A double-edged sword. So we tell our patients, we got to get your oral health in check. We got to get you back to a state of health. And in turn, we see patients whose blood sugars are easily controllable at that particular point. And they have to take less of the medication because the doctor prescribes less of it because now their blood sugar is easier to control because of the infection in the mouth. There's a link between periodontal disease and premature birth weight babies, as you said earlier. When you have periodontal disease, it causes hormones and mediators to increase to try to fight off the infection, but also hormones and mediators that are produced as a side effect from the infection. And those hormones and mediators send a false signal to the lady's body thinking, okay, now it's time to go into delivery, and they deliver the baby prematurely. So there's a gamut of problems between a mouth infection, your liver, rheumatoid arthritis is linked between periodontal disease. As we said, cancer, they're finding a link between periodontal disease and cancer because it's an infection in one part of the body that's going to have a cascading effect in other parts of the body.
Right. Well, it's like if you fight one war, which unfortunately we do in this country, not just one, but a few. Well, how many more can we fight before there's no more soldiers, right? And that's the defense system. I have heard that in Japan, in a university in Japan, they made a research that a person who has the HIV virus, which if it gets developed, turns into AIDS, as we know. So the HIV virus in itself is not necessarily, you don't want to have it, but it in itself doesn't make you sick. It's only when it blooms, whatever you call that in a medical term. We know this famous basketball player who has it, but it doesn't, it doesn't mature, probably because he has a good immune system. So if you have a bad immune system, this study in Japan says the HIV virus can much easier go into it. Now, thanks God, most of us don't have the HIV virus, but if it does something so drastic, again, the flu, the everyday fatigue, just like when you, as you said, when a mouth is out of alignment and you have shoulder pain, headaches and all that, your everyday life couldn't possibly be as lively as it should be. Maybe a good gum disease will fix the afternoon tiredness or the wake up tired already because your body cannot rest because it has to work all night long to make sure it fixes it.
That is correct. I try to compare periodontal disease to the flu. When a person gets the flu, it's just not in their head, it's in their chest. They make them weak all over. They just feel bad.
Right.
And when patients come to my office and they say they're tired a lot, they just don't feel peppy, so to speak. That's because the body is fighting a major infection in their mouth. So once that infection is brought under control, we've had many patients that say they feel better overall. From a social standpoint to their, peers talking to someone, that's improved their self-confidence and self-esteem, as well as function. There's no more bleeding. So it has a gamut of positive effects by getting that infection out of your body.
Sure, because if you're peppy, you sound peppy, and when you sound peppy, you are
feel
peppy, and you feel
exactly.
peppy, and people pick it up.
That's correct.
But is it true that there is obviously, apparently, very clinically studied that people who have reach a nice high age, and at the same time, are active, basically they're not sick, that they literally always have good teeth? And is there something to that, or is that just a hearsay?
No, that has some validity. They're healthier. Typically, a person's exercising a lot. They're concerned with their overall well-being, not just one part of the body, but their entire body. So they want to keep everything healthy, which in turn keeps the body healthy. But if you have infection in one part of the body, as I said earlier, it's going to have a negative effect in another part of the body, and you're going to feel it. You're going to feel it the way, from a cosmetic standpoint, you're going to see it. You're going to feel it from a function standpoint. You're not going to be able to chew your food because there's going to be pain there, discomfort, and you're going to feel it in other parts of the body, blood sugar, premature birth weight babies, cancer. So it does have a gamut of negative effects when you have an oral infection. And you should get it taken care of.
Right. And those things are obviously very difficult to fix once they're there.
Yes.
We know that. Now, I also have heard that lately, in the last year, 2-3 years, in the last few years anyway, surgeons, be it a guy who takes out appendix or tonsils or a guy who does a hip replacement, they start demanding for the patient to get a good bill of oral health. They say, go to a dentist and check whether you have any gum disease, because if you do, I cannot operate on you. So if surgeons notice that, if it's true, that means they realize that the body is predisposed to weakness, and if you cut in, any operation is taxing on the body, it's taxing on it, it's difficult. Then the guy says, no, wait a minute, I don't want to cut, because obviously a surgeon needs to make sure the body is otherwise as healthy as possible, otherwise complication. So did you notice that surgeons do that lately?
Specifically in my practice, I work with cardiologists and OBGYNs delivering babies, and they refer patients to us before they get to that part of the surgery or the delivery of the baby, because they want the oral health up to snuff, so to speak. Because if not, as you said, it's going to cause complications in the procedures that they're going to perform. Right. So they want to have immaculate, meticulous, good oral hygiene, bring the patient up to a normal hygiene level, and then they want to perform their surgeries. That way the patient heals without any complications and less post-op problems.
Right, because the body, for all purpose, doesn't care what you and me or a cardiologist or calls an infection, whether it's a lung infection or a gum infection. It's no different to the body. An infection is an infection is an infection is an infection. And it poisons the blood and weakens the body. So the surgeon, whether it's a lung infection or a gum infection, he says any infection in the body must go. And it's only lately, however, that they started realizing that the gum infection is part of that, because I think that it was a little neglected in the past.
You're exactly right, which is good because of our American Academy of Periodontology. We're doing a lot of collaboration with the medical community, and through research and interaction is working together to get an understanding of oral infections, how it relates to the remaining part of the body. And through that, surgeons, cardiologists, OBGYNs, and the other medical doctors are finding that, hey, they want to have total health. We want to have a good oral health before we proceed with doing any type of systemic surgeries, thereby cutting down on any problems, post-op morbidity, any post-op pain for the patient, and they heal and recover quickly. Because when that immune system is affected, you are putting yourself at risk for more infections and more complications from the oral infections and less success from the surgeries that you're undergoing.
Beautiful.